Here's a question your doctor probably never brought up. Can sex actually trigger a heart attack? It sounds dramatic, maybe even a little embarrassing to wonder about. But it's a completely legitimate medical question. And today, I want to give you a real, honest answer. Because the truth is actually more reassuring than you might expect. I'm Dr. Julian. And let's talk about what's actually happening inside your body during sex, and what the science says about cardiac risk. So first, what does sex actually demand from your heart? Think of it like a moderate walk. Your heart rate climbs, your blood pressure rises, and the physical effort is roughly comparable to strolling at a comfortable pace. Somewhere around 2 to 4 miles per hour on flat ground. For most healthy people, that's nothing unusual. Your heart handles that kind of load dozens of times a day without complaint. But here's where it gets interesting, and where some people do need to pay attention. There's a condition called angina, chest pain that shows up when the heart is working harder than usual and isn't getting quite enough blood flow. Researchers followed 35 patients who already had a documented history of angina, and they found that 65% of them experienced chest pain during sex and had to stop. So, if exertion triggers chest discomfort for you in daily life, on stairs, during a brisk walk, that's worth a conversation with your doctor. Before assuming sex is fine, if walking upstairs leaves you winded and aching, sex deserves a second look. Now, here's the number that should genuinely put most of you at ease. Large population studies show that somewhere between 0.9 and 1.3% of heart attacks are linked to sexual activity, either during or within 2 hours after. That's already a very small number. But researchers dug even deeper in a landmark study on heart attack onset triggers. They looked at average 50-year-old men with a baseline 1% annual risk of having a heart attack. If those men had sex weekly, their risk nudged up to just 1.1%. For men already classified as high risk, carrying a 10% annual risk, weekly sex moved that number to 10.1%. Essentially a rounding error. For most people, the risk sex adds to your heart is smaller than you'd ever imagine. So, where does that leave you practically? Cardiologists generally think about this in 3 tiers. If you have no chest pain, no uncontrolled blood pressure issues, and no recent cardiac events, you're in the low-risk group. Go live your life. No restrictions needed. If you have occasional chest pain with exertion, or you're carrying several cardiac risk factors, you're in the intermediate zone. That doesn't mean no. It means have a real conversation with your cardiologist so you can move forward with confidence. And if you've had a heart attack recently, you're experiencing chest pain even at rest, or you're dealing with significant heart failure, please hold off and speak with your specialist first. This isn't about fear. It's about timing and safety. The takeaway here is simple. The vast majority of people watching this have nothing to worry about. Your heart is built to handle normal physical activity. And for most of us, sex falls well within that range. If this answered something you've been quietly wondering about, go ahead and give this video a like. It genuinely helps Dr. Julian reach more people who need to hear this kind of straightforward, honest medical information. And drop your question in the comments below. Take care of your heart, and take care of yourself.